Thank you, Geraldo. I'm at Petite Science Memorial Hospital here in Atlanta, Georgia, where I was able to speak to many physicians and physical therapists to learn some more information on opioid analgesics. More specifically, we discussed the pediatric uses as well as how it affects physical therapy treatments. I was surprised to learn that children are allowed to take this drug, even though it can be dangerous in large doses. Children with moderate to severe pain can take oxycodone, which is prescribed in a smaller, safer dose of about 0.5 to 0.15 milligrams per kg orally every 4 to 6 hours. The maximum dose is 5 milligrams. For children who have not been on oxycodone before, it should be given with food, and the dose should be tapered off until discontinued in a prolonged or long-term use. These dosages may need to be adjusted if the patient has kidney or liver disorders. Renal, kidney disorders, dosing must be adjusted. If the patient has a creatine clearance of 10 to 50, then the dose should be decreased by 25%. If they have a creatine clearance of less than 10, the dose should be decreased by half. There may also need to be some dosage adjustment for hepatic or liver disorders, but there are no current pediatric guidelines set, so one should refer to the adult hepatic dosing guidelines. Well, they mentioned that opioid analgesics can be very useful for people who need physical therapy while at the hospital, or even when they're having therapy outside of the hospital setting. I, for one, know that physical therapy can be super painful, so it's good to know that pain medication can be taken before or after therapy. In the physical therapy setting, PTs need to be aware if the patient is taking oxycodone or another opioid analgesic. The purpose of these drugs is to reduce or eliminate pain. This could be beneficial for therapy because the patient will be able to do more because they are not inhibited by their pain. However, the therapist needs to be cautious to not overwork the patient because their pain response is blunted. Some of the side effects of these drugs may affect physical therapy as well. Most notably, there can be a depressed cardiopulmonary response. Therefore, PTs need to constantly take the patient's vitals throughout the treatment. Patients can also be nauseous, dizzy, and/or confused. Nausea and dizziness may keep them from fully participating in the therapy. The physical therapist also needs to be wary if the patient is confused so that they can ensure that the patient has a full understanding of what will occur during the therapy session. For Channel 7 Action News, I'm Leslie Matenopoulos.